some of the most common underlying conditions / comorbidities for COVID are things over which individuals have some control. And this is anecdotal-ish. I received the Oregon Health Authority's regular COVID emails, and I've been doing that. I've been looking at them since the beginning of the pandemic. They come out many times a week, and I've noted this. And in fact, here we have, Zach, you can show me. This is just a web version of the most recent one. It came out on yesterday. So they're talking about safety, and the very bottom, every time one of these comes out, they talk about cases and deaths. And they always have a separate little paragraph for each of the deaths recorded since the last one has come out. And I have yet to see one. And again, I've not seen absolutely every one of these, so it's possible I missed one. But every single death that I have seen, and there's been 2,779 in Oregon thus far attributed to COVID, has as the final sentence either he had underlying conditions, or she, or presence of underlying conditions is being confirmed. I have never seen a death reported in the Oregon Health Authority's emails that they send out that there were no underlying conditions. And again, I may have missed one, but it is at least vanishingly rare. And so this, Zach, if I may, raises the question of, well, okay, what are then the underlying conditions? What are the comorbidities, which are often used interchangeably, these two terms, underlying conditions and comorbidities for COVID? What are they? And, strangely, given that underlying conditions is this term that is used in the Oregon Health Authority's emails every single time, they don't have it defined on their website anywhere. And I went down that stupid rabbit hole a bit, looking for, who defines it which way. I ended up at the CDC. For COVID-19, here we go. People with certain medical conditions, which is and it's updated regularly, and it's okay. It's got a lot of hedging and such. And there's a lot of things that we don't have control over, things like cancer and chronic kidney disease and COPD, chronic obstructive pulmonary disease, and dementia, diabetes. I will say that some of those that we've looked at already, even though some diabetes, some COPD, some chronic kidney disease, while not dealable with particularly effectively in the moment once you already have it, had you had access to excellent quality of life resources early on, things like good diet and active exercise and time outside and such, you would likely have at least delayed these things, and you might not have them now. So there is an ability to make yourself healthier, even against some of these things, but less so once you already have them. And then actually, Zach, if I can just have my screen back here, it's a fairly long list, but the page also includes down near the bottom these three things: overweight and obesity as a category, smoking, current or former. And that's interesting. We talked early on, like in April of last year, I think, about there being some counterintuitive data about smoking, and how protective it was or was not actually against COVID. But at this point, they've got smoking, current or former on the list of comorbidities for COVID, and substance use disorders. And all of those things individuals have some control over. And yeah, it's hard. And yes, sometimes people really can't seem to make it work and to extricate themselves from the grip of whatever it is. All of us struggle with something probably in some related health space, right? Where we know that we aren't doing absolutely the most that we could do to make ourselves the most healthy and anti-fragile against things like SARS-CoV-2. But we also have what seems to be a downplaying of those conditions over which people do have control. Like, if every single death that I have seen in the Oregon Health Authority attributed to COVID also says that the person who died either had underlying conditions or that their underlying conditions were being confirmed. And if separately I have seen, and I didn't chase it down, but separately I've seen that the most common underlying condition that people have is being overweight, is being obese or overweight. Well, that is something over which we have control. And, me saying that isn't fat shaming. It is talking about the actual truth that something about, and it's going to be in metabolic syndrome space, right? That something about being, having a lot more weight on your frame than is optimal allows the virus to get in and grab a hold more easily than it otherwise would.
Or it could be a third correlate. It could be that sedentary lifestyles produce weight gain and result in you getting less vitamin D. But somehow counteracting these things, and advice that we've been giving, go outside, right?
Going outside doesn't inherently cause you to lose weight, but
no,
my point is, not only have we seen probably over-reporting of cases from, again, following from this New York Times article from last summer with, the high critical threshold values for the PCR test for COVID. But we're also seeing basically no discussion on the media about the things that each of us could be doing to help reduce the risk. The only thing we are being told, the only tool we are given is be vaccinated. That is the only thing we are allowed to discuss. It's not just, you can't talk about ivermectin because that's medical misinformation. You can't talk about losing weight. Is that medical misinformation? Seriously, it's diabolical.
It is diabolical. The fact is, this is a complex system. It has lots of different inputs. Being vaccinated does make you much less likely to get the disease. It's one factor in the equation.
And guess what? Being at an appropriate weight for your size seems to be strongly correlated with not dying from COVID.
Yep.
It's a comorbidity of COVID. That's what it means. Why don't we talk about this?
Yeah, no, the problem is there's some sort of, at the most generous thing you could say is that there is some sort of a political map that makes certain factors in your likelihood of contracting the disease discouraged from discussion, and other factors highlighted beyond all proportion. And the elephant in the room being that actually there is an alternative that seems to be highly effective, which we're not allowed to discuss because the CDC and its bizarre set of beliefs suggest that it would be counterproductive.
Well, it further infantilizes all of us. It takes away our agency. The idea that none of us can do anything, just at first. And, we were in favor, we hated it, but we were in favor of strong lockdowns to shut this thing down. And, instead we've got a year and a half of garbage, right? But we were in favor of some of the things that could have been done and were, as far as I can tell, done kind of nowhere effectively, with the possible exception of, Taiwan, maybe South Korea, Vietnam, early on, some of the countries that actually really locked down and really had low caseloads. And I'm not sure I'm remembering exactly which countries did it, but actually there are things that individuals can do. And individual level and population level analyses are different. But in the case of actually you're reducing the risk that you will get sick and put further strain on the system and make other people sick, that's win-win. That's good for the individual and good for the group. And yet somehow those things that individuals can do are completely taken off the table, with the exception of the one thing that you can go and you can get your shot and you still have no agency in that. It all seems in service of, you do what we say and we'll keep you safe. And you know what? They're doing a terrible job of keeping us safe.
Yeah, they have done a really terrible job.
Why do we believe them now?
Yeah, I think this is worth pointing out. They have done a terrible job of keeping us safe. They've told us that masks didn't work when they believed that they did. They told us they prevented us from going on to beaches and in parks. Right,
they kept us indoors for a virus that transmits indoors pretty much exclusively.
Right, and the fact is, just simply spending more time outdoors would have reduced the rate of transmission
for everyone.
Right,
even if all of us, even if the entire planet went outdoors at the same time.
Right.
And in fact, we've just written this into the afterword of the book.
And
right?
in addition,
right.
In addition, going outdoors, especially the beach, would have produced an awful lot of vitamin D, which seems to be a critical contributor to a native innate immunity to this disease.
And mental health. We could have seen each other unmasked outside. My God.
So, let's put it this way. We know from the question of masks, from the question of outdoor transmission, from the question of vitamin D, that they have given us bad information or failed to give us good information when the evidence was very clear about it. And that has had a huge cost in terms of suffering, damage to people, and the loss of life. So who the hell are these people to be declaring what's misinformation?
Yeah.
Right? They've been purveyors of misinformation. And the best thing we can say is that maybe they thought it was good information at the time, but they're hardly the oracle.